Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Helene Calvet. I'm the Deputy Health Officer here at the Healthcare Agency. What inspires me about medicine, really, I think most people go into medicine because they want to help other people. And I've had the opportunity to experience medicine in many different situations in different countries, pretty much from the beginning. And I think probably my first big trip was to India when I was a fourth-year medical student. I did a 4-week rotation there, which was just fascinating. It was a pretty high-level hospital in India, but we went with the Indian medical students to the countryside, so we saw how they chlorinated wells, how they taught people about mixing up oral rehydration solution during cholera outbreaks, how they did vaccination campaigns. And so I think that kind of planted the seed for my interest in public health and some of those kind of higher-level activities. So India was my first big trip. In 1993, after I got done with residency, I went down to Guatemala to learn Spanish and then identified a local group there to go to work with, and I worked with them for 3 months. So again, this was in the countryside. It was a very poor area. It was a coffee growing area, so there was a lot of these, what they call fincas, which is where they grow the coffee, a bit mountainous area, not great roads. People had to walk a lot. A lot of them didn't even speak Spanish. They spoke Quiche and Kaqchikel, which are 2 of the local Mayan languages. So I saw patients there. We went out and did health checks on the fincas, so piled up into a car or hiked up into the mountains with our equipment to check on the children, to weigh them, to do deworming campaigns or give them parasitic medications. And that was an amazing experience. I mean, when you're working in a situation like that where there's just not a lot of resources, you do the best you can. During my work in public health, I've had the opportunity to do a lot of teaching in other countries. My former job as a faculty member with the California SD HIV Prevention Training Center, we did trainings in Region 9, which included Hawaii and the Pacific Islands. So I had the opportunity to go and teach in the Republic of Marshall Islands, in Ebi, which is a tiny little island in the middle of the Pacific where people are very poor. There's no fresh water. There was a cholera outbreak going on just before we arrived. Went on to Chuuk in the Federated States of Micronesia, subsequently did some work in Guam and in Saipan, which is in the Commonwealth of the Northern Mariana Islands. Got invited to Vietnam, which was an amazing trip. One of the first times I had to teach in a different language. They had to translate everything into Vietnamese. I got to spend some time with the clinicians there, which was really interesting. I think all these experiences, I love teaching, and I always learn a lot more from the local practitioners because, again, they're the ones that have to deal with their situation day in and day out, their lack of resources and how you get things done in those situations. I've also had the opportunity to do some volunteer work in cervical cancer screening. So the first project I worked on was in a rural area of Guatemala. This was in 2003. A friend of mine from Martin Luther King Hospital set this up. It was actually her husband's family's land. She trained a local nurse practitioner on doing pap smear. She hired some promotoras to go out and promote it. We had a big group there, about 25 medical practitioners. We did over 500 pap smears in 4 days. They were stained and read on the same day. If they're abnormal, they brought them back to have colposcopy. Found a number of cases of advanced cervical cancer that were then able to be treated by a surgical team that came in a couple of weeks after we were there. So that kind of thing was really gratifying because we were providing a service that they couldn't get, but also putting a mechanism into place to continue that service long term by training that local nurse practitioner and setting up a way to get that done. Last year, for the first time in many years, I actually had an opportunity that was totally new, and that was doing some consulting work with a group of people I worked with in Long Beach. We went to Bangladesh and did a consultation for the WHO office there, looking at their immunization program. So got to travel throughout the country there, interviewed people from the World Bank, from USAID, high levels of the Ministry of Health, all the way down to the skinny little Bangladeshi man who rides his bicycle 20 miles a day delivering vaccine to the different vaccination areas, as well as see some of those other local practitioners. So that was a very interesting and gratifying experience. So now I'm looking to the next phase. What do I do after I retire from here? Where can I make best use of my skills? But I definitely do want to get back to some of these areas that I've been to before, because I think I have a lot more to contribute.
My name is Ann Pan. I work for the County of Orange. I've worked there about 10 years now. Basically, I work as a pediatrician, so there are times when we have opportunities to use our medical skills in travel medicine. The trip I'm going to talk about today is a trip that I took to Haiti. And we actually went with this organization called Mission of Hope Haiti, and they do sponsor medical mission trips. I've actually gone on several different missions, so I had the opportunity. I've gone not only to Haiti, but also to Thailand, and I went to Kyrgyzstan also. That's the nice thing about having medical education, is you do have the opportunity to use your skills to work in areas where they may not have as much opportunities, or they may not have access to medical care. So this first picture is when we first take the trip out to Haiti. So usually the team stays in a compound, the Mission of Hope compound, and it's from there that we base like all our trips to the villages, because all the clinics are mobile clinics. So we take all of the equipment, we take all the tables, everything. So before we go on every trip, we need to make sure that we count and package all the medications, because we do administer medications as well as vitamins at each site that we visit and each site that we hold a clinic. So this is basically preparation. So in essence, you fly there, and then after a trip, then they give you like a little bit of rest time, and then they're like, oh, it's time to count meds. So that's what we're doing here. We're all counting medications and packaging them. On average, I think for each trip, this last trip, we went to 4 different villages. So it's 4 different clinics, and we usually try to get all the medications done that first day. So in this picture, you can see that there is a line of people waiting for us as we go there already. On average for each clinic, I would say we usually saw about 100 people at each time. And there are maybe four physicians, and we also have nursing and pharmacy staff as well. And we do provide other support people, because there's usually a lot of kids around. So we like to give them things like coloring books, like packages of coloring books with crayons. Some of the volunteers will sing songs with the kids, play with them. And so people are usually ready and waiting for us when we go there. And you can't really see that in the picture, but when we go there, it's like in these huge trucks. And as soon as we pull up, then everybody comes out and helps us unload, even the patients too. Like the patients are helping us set up our tables, they help us set up our pharmacy. It is definitely rewarding that we are able to have these medical skills, so we can have this opportunity to travel. I would tell anybody who is thinking about traveling for one of these trips to maybe give it a try, because you kind of think you're going to administer to people, but a lot of the times you'll find that you actually will get more out of it than they would. And it just gives you an opportunity just to interact with people, and it's kind of reminds us of how fortunate and blessed we are. You really you enjoy being able to be of service to people. So I think that's the best part of it.